My dear counsellor friends, when the rapid test is positive, you really have to be compassionate when you announce the result, because it's a difficult moment for the patient. Be empathic and give space for some hope, because, as we mentioned in the previous film, one needs to perform another confirmatory test to confirm a chronic HCV infection. Moreover, make sure you have enough time to explain the test results in detail. Hi, how are you?
I feel nervous. And is it positive?
Yes, the test result is positive. I understand that this may be difficult news. It means your body already met the virus. But we don't know if your body eliminated or if it's a chronic hepatitis C infection. So we need to perform a different diagnostic test called hepatitis C viral load. It would be great as well to check your liver function to see if it's affected.
What should I do?
First of all, you should consider to do the viral load test. Is that possible for you?
Well, I don't know. Is it expensive? And where can I do that?
Yes, it's a little bit expensive, but it's really worth to do the test. Only then we will be able to know if you are chronically infected. You can do the test, for example, in the university hospital.
Okay. Well, I will talk to my family about it. Maybe they can help. I'm really worried about that result.
I understand, but really, for the moment, you should not be too worried. It's good that you are concerned about your health. But after all, you are still young, and hepatitis C is comparatively slow progressing disease. So just to remind yourself, we are not yet sure that you are chronically infected, and we do not know if your liver has been damaged much by the virus.
Okay, I understand.
Could you remind me as well if you think you are currently taking any risk for transmitting hepatitis C to others?
Not sure. I don't think so. Well, yeah, sometimes, I inject together with friends, but we're really careful and use our own material all the time.
And what about the water that you use for preparing and the tourniquets?
Why do you ask? I don't understand.
Because HCV is often transmitted not only by unsterile needles and syringes, but as well by all other materials that are used during preparation and during injection, namely cookers, water containers, or tourniquet. So if you want to protect your friends, you should be careful to not share or to not reuse these materials. It's also better to inject yourself than asking someone to do it. But if it happens, try to protect yourself and the injector. Before and after injecting, it's important to wash your hands and to clean the surfaces around.
Ah, now I understand why you ask.
Then, it's as well important that you take care about yourself. It would be very good if you take measures to limit the main complications of HCV infections, such as fibrosis, cirrhosis, or cancer.
Yeah, is alcohol consumption important in these regards?
Alcohol is one of the most common causes of liver damage. By regulating and reducing your consumption, you reduce the risk of developing cirrhosis or cancer.
And a friend of mine even says that one has to be careful when taking certain medications and treatments. Is that right?
Yes, that's right. Some medications are also toxic for the liver. It's better not to take medication by yourself without asking a doctor. And if you see a doctor, it's better to tell him that you had a positive hepatitis C test. Have you already been tested for HIV and hepatitis B?
Yeah, last year both were negative.
Oh, it could be good to do it again. For hepatitis B, there is a vaccine that we can give you if you are negative. For HIV, there is treatments available, as you might know.
Yeah, sure, that's a good idea.
You could then tell me if you have talked to your family members concerning the viral load test.
Yeah, okay, I can come next week to do those tests, and then I will tell you if I talk to my family members.
Okay, right. Is there anything else you would like to discuss?
No, thanks. Not today.